Okay, so we'll make a start then, and the Deputy First Minister and I are very pleased to have with us at the press conference this afternoon our Chief Scientific Officer, Professor Ian Young. And as you will know, earlier today, the Health Minister, Robin Swan, released data from modelling we are conducting in Northern Ireland that is informing the intensive hospital planning for the surge in COVID-19 cases. It did, I have to say, make for grim reading, but it also underlined the importance of members of the public adhering to the public health advice that has been issued by the Executive and indeed by governments around the world on how to contain this pandemic, and Ian will provide further detail on all of that shortly. But according to the data, in the reasonable worst case scenario, Northern Ireland's Health Service would have a realistic prospect of coping with the initial wave of COVID-19 cases. Under this scenario, the hospital admissions for COVID-19 running at 500 per week, and it is estimated that a peak number of those people whose lives would be lost would be 3,000 over 20 weeks. And that is a sobering statistic. The death toll would be about 500 people short of the lives lost during the Troubles. And the loss of each of those lives is a huge blow, not only to their families, but of course to the communities from which they come from. And in a small, tight-knit society like ours, we all are likely to know someone who will be impacted, and it will be a cruel blow, and we will need to do everything we can to comfort and support their relatives and indeed each other in the difficult weeks and months ahead. So before we ask Professor Young to speak, Michelle will make a few comments.
Well, Ian will speak to the details of the new modelling work, but there's no doubt that this modelling work will alarm people. People will be concerned. It's a scary prospect for all of us, but particularly for those older people and people who are vulnerable. It only serves to reinforce how crucially important it is that people keep doing the things that are asked of them at this time in order to allow us to be able to save lives. The actions of each and every one of us are crucial in reducing the death toll. Washing your hands well and often, staying at home, those messages are still the key messages of the day. If you don't have to go out, or if you do have to go out, keep a safe distance of 2 metres between yourself and other people. If you have symptoms of persistent cough or a fever, follow the self-isolation advice and make sure the virus doesn't spread. Like I've said and recognise, these are frightening times, and I think everyone shares that fear about what is upon us. But no one feels that more acutely than our healthcare workers. They are worried too about the risk to themselves and to their families and to their patients. They are terrified of not being able to continue to do their jobs. I acknowledge that fear, and we have to build confidence right across the health service among our staff and make sure that they are protected and supported in the life-saving work that they are doing. Our healthcare workers are crying out for PPE. They're crying out for testing. We have just spoken with the RCN, and they have told us this very clearly. They are concerned that the NHS guidance on the use of PPE during this pandemic doesn't align with the World Health Organisation's advice. We have to listen to our healthcare workers on the front line who are telling us all of this. They are experiencing this right now, and they are telling us that they need better access to PPE. And that's why we're using every possible procurement route available to us to source and secure vital equipment. The Health Minister and the Finance Minister are working closely together to procure PPE and other supplies. In fact, as we speak, the two ministers and the respective procurement teams are meeting to discuss progress. The teams are pursuing supplies with both Irish and British governments. Minister Murphy spoke with Simon Coveney, the Taoiseach, last night, and this afternoon he's also had discussions with the Department of Health and Social Care in England. We are ramping up supply from local companies, including those that have repurposed their businesses to help us fight back against COVID-19. We spoke with our Chinese Consul General, Madame Yang, this morning, and she is donating 10,000 masks immediately, with further supplies imminent from Shenyang and one of our partner provinces in China. And on testing, the RCN are asking us to prioritise the testing of healthcare staff to undertake surveillance among healthcare workers. These are not big asks, these are basic requirements. And the modelling information published today only highlights the urgency with which this needs to happen. and the need for a joined-up approach across this island on modelling, messaging and response to this pandemic. I'm further encouraged by the progress that's been made on the North-South Memorandum of Understanding today, which will be finalised imminently. I'm now going to hand over to Professor Young.
So thank you. And I'm going to comment on the results of the modelling work, which I was asked with a group of expert colleagues to undertake to look at what might happen to the progress of the COVID epidemic in Northern Ireland over the next few weeks and months. What we're presenting is not a prediction about what will happen. It's the description of a scenario which might happen. And we all have, in our capacity, the ability to influence the events to come. What does a reasonable worst-case scenario mean? Well, it's a scenario that might happen in the future if people do not adhere particularly well to the types of distancing measures which are currently in place. At the moment, we don't have accurate data to measure how well people are adhering to those distancing measures, but this assumes that it's happening reasonably well, but not as well as it could be. Under those circumstances, we expect this current wave of the epidemic to peak around the 13th of April, sometime between the 6th and the 20th. In the reasonable worst case scenario, at that time there might be as many as 180 patients requiring ventilation and in critical care. Up to 500 people would be admitted with COVID to hospital during the busiest week, and there would be a total of up to 3,000 deaths in the next 20 weeks. Those are indeed frightening numbers. As I said, it's not a prediction, but it's something that could happen. And the challenge, I think, to everybody is to adhere as strictly as possible to the social distancing measures which are in place and which have been referred to in the weeks and months to come. If we do that, then this scenario may not arise. We expect the peak of the epidemic to occur at about the same time. If people don't adhere well to the measures, then there will continue to be very high levels of admission to hospital, patients on ventilators and in critical care, right through to the late summer. If people can adhere really well to the measures, then we expect the peak to fall a good deal more quickly than that. So that is the summary of the best case, of the worst case scenario, and I hope that what we actually see, if everybody plays their role in our society, may be somewhat better than that.
Okay, Mark, are you there?
I am indeed. Hopefully you can hear me.
Yes, indeed. Go ahead.
Excellent. Very good afternoon to you, Ministers, and also Professor Young. First of all, to Professor Young, based on the modelling, I missed a bit of the video there as my connection dropped out, but he explained the rationale behind these figures, and does it indeed make way for a second wave of COVID-19 to hit later in the year? And to the First Minister and Deputy First Minister, just on the issue of testing, Arlene, you said that you are content to follow the advice of the CMO, who in turn received his advice from the UK government, but is it not the case that you're being too slavish to the UK government policy on testing? Would you not be better following the policy taken by the World Health Organization, which is to test, test, test? And indeed, to the Deputy First Minister, you've been saying that we should be taking the lead from the Irish government and testing more people. But as Dublin is now finding out, there's no guarantees that ramping up testing will deliver a better outcome, as people are literally dying waiting on the results. Is it time for a bespoke system for Northern Ireland?
Okay, Ian, do you want to go first?
So if I take the first question, which is about the origin of the figures in the model. So modelling makes a variety of assumptions about how people behave and about the transmission of the virus during the epidemic. Those are based on extensive scientific research and observations in other countries and in the UK and Ireland of the course of the current epidemic. So effectively, we use those basic underlying assumptions along with local information about Northern Ireland, the age distribution of our population, for example, and through quite complicated mathematical modelling, then we can estimate the likely course of the epidemic. I think you're right to wonder what will happen when what I've described as the first wave of the epidemic is over. And at that point, we have still continued to assume that the current restrictions remain in place. And that may or may not be the case. That will be a policy decision informed by the best scientific evidence. But once you relax restrictions, it's almost inevitable that there will be a recurrence of the virus. And that will occur until a substantial proportion of the population have immunity against it, either as a result of having suffered the virus infection and recovered, or as a consequence of having received a vaccine which gives them immunity.
Okay, Mark, so in relation to your question about our Chief Medical Officer takes advice from his other colleagues in the United Kingdom, but as we have pointed out over numerous days now, he's also in constant contact with colleagues in the Republic of Ireland, as I've said, standing on this press conference stage every day. The Chief Medical Officer speaks to Tony Holohan in the Republic of Ireland daily, sometimes many times daily. So I take my advice from our Chief Medical Officer, who looks at, as Ian has said, not just what comes from London, but our own specific data here in Northern Ireland as well, and I think that's very important. But in relation to testing, of course, we all want to see more testing. I want to see more testing, Michelle wants to see more testing. It's vitally important, and as Michelle has indicated, we had a teleconference with the Royal College of Nurses earlier on today. They, of course, raised again the need for frontline staff to have testing, and we're pushing to get more testing available. But as you pointed out, the Republic of Ireland are finding difficulties now in relation to getting the test results back to people, and I think that is a problem as well. So we do need to have more testing. I spoke to the Secretary of State earlier on today to say that we want to push ahead in relation to more testing, and he gave me the commitment that he would very much say to the UK government that Northern Ireland wants to move ahead. We are, per head of population actually, in UK terms, doing more testing in Northern Ireland than in Scotland and Wales, and I think sometimes that's missed, but we want to do more, and I think it's right that we want to do more.
Can I just say that this is not about slavishly following any model. This is about what's right for the people who live here. I follow the World Health Organization's advice. I follow the European Centre for Disease Control's advice. I think that we need to take decisions here that affect our people here. Our executive priority is to save lives. That is the #1 priority through all of this. I've said every day on this platform that there's a difference in emphasis in terms of the testing and in terms of PPE. I think that in terms of testing, we need to do more. We had this discussion earlier with the Royal College of Nursing. They are crying out for nurses to be tested, and we know that that's a necessary part of, one, giving them confidence, be able to do their job, which they do so ably, and two, being able to keep them in the workforce, because we need our nurses and our healthcare workers now more than ever to be able to be in work and caring for people who find themselves in that circumstance. So I think that we need to, certainly for me, my emphasis, I am uncomfortable with the fact that we are following a system that is at variance, I suppose is the way to put it, with the World Health Organization's advice and the ECDC advice. But I just continue to make that case in the executive. Today, even the Health Minister has said that we need to do more testing. We're going to move from 1,100 to 1,300, and then we need to see even more of that continue over the weeks and months ahead.
Thanks, Mark.
Thank you.
Michael, are you there?
Hi, Arlene. Yes, thanks. I just wondered, in terms of this predicted, or not predicted is the wrong word, in terms of this potential second wave, when is that likely to be, and how, if at all, will we be better equipped to deal with it when it comes?
So the occurrence of a second wave is a risk once you begin to release the current social distancing recommendations and people begin to mix again more widely in the community. And I think we're beginning to see evidence of that occurring in a number of other countries internationally who've initially been very successful in terms of controlling the epidemic, but where cases are beginning to recur. And I say that's an almost inevitable consequence of the biology of the virus and infection until you have a substantial population immunity. So at the moment, no decisions have been made about when the current social distancing recommendations would be relaxed. As a group of modellers, we will be looking carefully at the likely impact of releasing those recommendations, either singly or as a group. And then once that happens, we'll be monitoring very closely the levels of infection which might occur in the population, and seeing what what measures could be taken to prevent the second wave or minimise its size.
First question for the First and Deputy First Ministers. This peak is coming faster than any.
Oh, frozen. He's frozen.
Day after day, we're told that. You can't hear me.
You're frozen. Gareth, try again.
Okay, is that any better?
Yes, that's fine. Go ahead.
Good. First and Deputy First Minister's first question. This peak is coming quicker than any of us want it to be coming, but it's coming nonetheless. How far off are we from being prepared to?
Okay, I think the question you're asking
is that for extra testing?
We're sort of guessing what you're asking here, Gareth. So I'm going to say that the Department of Health is publishing today its plan for care and treatment of the initial anticipated surge of COVID-19 patients, which of course is based on the modelling which they have had sight of now. As you know, the surge plan has been around now for, goodness, I've lost all track of days, but I think about 10 days now, and it is a live document and therefore will react to the modelling that has been brought today. They will be looking at their capacity to deal with the numbers of intensive care patient in the weeks ahead. And I can also confirm that the department is looking at the Icon Centre at Balmoral Park as our Nightingale Hospital. That will be to further increase bed capacity to prepare for that possible further second wave should it occur later on in the year. Do you want to say anything about testing?
Can you hear me? Can you hear me or
Try
not?
again.
Could I just ask Professor Young? He talks about a reasonable worst-case scenario of 3,000 deaths, which is bad. But is that an improvement on the worst-case scenario that the Health Minister talked about a couple of weeks ago of 14,000 to 15,000 deaths?
So I think that there is a worst-case scenario than the one that we have talked about, which is the reasonable worst-case scenario. The worst case scenario would be if there was no measures in place effectively and no mitigation, nothing to prevent the spread of the epidemic. And under those circumstances, then the much larger number of deaths, which were mentioned by the Minister, would indeed be a realistic outcome. I mean, I agree completely that 3,000 deaths is an extraordinary event to occur in the life of Northern Ireland and really terrible for everyone who might be impacted. I hope that if people really stick to the social distancing measures, that we will do significantly better than that. So there's a message for everyone in our society about that. My only other comment is that 3,000 deaths is the risk of what might happen in the first wave, and does not take into account the possibility of what might happen if there is a second or subsequent waves of this epidemic.
And just to add, there is nothing in today's modelling to suggest that anyone should stop doing what they're doing. Everybody needs to continue to follow the public health advice, keep washing your hands to kill the virus, keep staying apart. These are the crucial elements to get us through this alongside testing. So I think that don't anyone take, just to be very clear, don't anyone take comfort from the fact that the modelling that's been produced today, it shouldn't mean that we should stop doing anything that we're doing. And I think that's the message that Professor Young wants everyone to hear today.
Okay, Sam.
Good afternoon, First Minister and Deputy First Minister. The vast majority of the public here clearly want to see politicians forgetting about flags, forgetting about ideology at this point, and just working together to try to save lives. And no doubt all of you are serious about trying to do that, but we have had these points of conflict between the two of you in particular, between your parties. So, First Minister, in the Republic, we've seen the Irish Army involved in setting up testing centres, expanding capacity, and we now have an order for PPE, which is channeled through Dublin. Can you say categorically that you will not stand in the way of any practical cooperation with the Republic, which could save lives here? And Deputy First Minister, likewise, we have seen the British Army, which has lots of experience of epidemics in other parts of the world, constructing a massive hospital in London to try to increase capacity there. We know that we're in an even more dire situation in terms of hospital beds than is the case in the rest of the UK going into this in terms of ICU beds. Can you be absolutely categorical that you will not stand in the way of the Army being involved in increasing capacity in Northern Ireland? Or is it the case that ideology here is more important than expanding our hospital capacity at sites like Balmoral, as the First Minister has said?
So let me say very clearly and as categorically as I can, Sam, I will not stand in the way of any practical cooperation between ourselves and the Republic of Ireland. In fact, I have been really very heartened by the practical cooperation that is taking place on a day-by-day basis, particularly between our chief medical officers, but not solely between them. I'm sure Ian has been talking to his colleagues in the Republic of Ireland as well. I know that Robin Swan speaks to Minister Harris. I spoke to Minister Coveney on, what day is this, Wednesday? On Monday, and then we had the conference call yesterday. So there's absolutely nothing, and I want to be very clear about this, standing in the way of cooperation, practical cooperation, making sure that we take the appropriate actions, and I want to say that very clearly. We have, of course, benefited from being part of the United Kingdom, whether that's in our economic packages, whether it's in our PPE orders. We're pushing for our testing orders to come through. So I think actually we are in a good place to benefit from cooperation with the Republic of Ireland and, of course, benefit from our membership of the United Kingdom. So absolutely want to say that to you categorically.
And can I say to you, Sam, I've said from the very outset that this is not normal times. One of the very first things I said at the first press conference was that we are not living through normal times. So I encourage you also as a journalist to not present things in terms of division. Just because there's a difference between people's emphasis around when we should do things and how we should do things does not make it an orange and green issue. It doesn't make it about London versus Dublin. It doesn't make it about anything else other than I have a particular viewpoint which I will express time and time again because I feel obliged to. Because this is about being in the middle of a pandemic that we have never witnessed before. This is about difference in terms of the approach. This is about my strong belief that we need to follow the World Health Organization, the ECDC advice to the letter of the law. So I will continue to make that case. That does not make anything that we do as an executive orange or green. So I encourage you as a journalist to try help us to get the public message out, help us to be able to emphasise where we have unity, help us to be able to put across that this is ultimately about saving lives, and we have a duty as political leaders to make decisions in the best interest of the people that we represent.
And can you address my question, please? Because I asked a very specific question which you've evaded there. Will you stand in the way of the Army being used to save lives?
What I have said very clearly, and I've said it on this platform yesterday and I believe the day before, if we need a field hospital, then we need a field hospital. A field hospital is a hospital that's not in a hospital building. And I think that that's something that we're planning for. And it's also going to be, let me be also very clear about this, it'll be a health and social care hospital, not an army hospital, it'll be a health and social care hospital. We need to do what's right by our people in this period of time. Stop trying to highlight division. That's my plea back to you. Highlight the positive, show where we are working together. But don't take everything that we say whenever we divide on issues or have difference of opinion on issues as orange and green, because that is not the case here.
Okay, thanks very much. Thank you, Professor Rowan. Thank you.